So firstly, for general condition, the patient is in middle grade, and the patient, what is your age?
25.
Okay, so the patient looks according to his age, and can you lift up your hands? Okay, how about your legs? Okay, so the Glasgow Coma Scale of the patient is 15, and the patient is in alert consciousness. And the patient's posture is forced as the patient is lying down supine with his right calf fixed by the spleen. And the look of the face of the patient is without pain. It's normal due to an IV morphine is being given. And may I know your weight and your height?
70 kg and 175.
Okay, so the patient weight is 70 kilogram and his height is 175 centimeter, and by calculation his BMI index is 22.5, which is in the normal range. And by inspection, the patient constitution is normostatic, and the skin of the patient in all sides besides the local status, it's normal skin color and absence of any pathological skin elements or scars or rashes or hemorrhagical spots. And okay, can you give me your hand? Okay, so the patient skin turgor is normal and it's moist, it's normal. And the nails are normal too, and the hair is also normal. So for the subcutaneous fat, it's having normal development and it's symmetrical, and there's absence of edema in other sites than the local status. And for the lymphatic system, it's not visible. So by palpation, it's not palpable. And do you feel pain?
No.
No. For the muscular system, so okay, do you feel pain?
No.
Okay, so by inspection, the muscular system has normal development and it's symmetrical, and patient doesn't feel pain while palpating the muscular system. So can you grab my hand? Okay, the other. Okay, can you press it? Okay, can you resist? Okay, so the strength, the muscular strength and is normal. And for the bones, okay, do you feel pain?
No.
Okay, so by inspection, the bone is symmetrical in development. There's no shortening or lengthening, and it's normal development, and patient doesn't feel pain while palpating on the bone. But by inspection, on the right calf, it is covered by spleen, and the bone is not inspectable. And for joints, okay, can you move your arm? Okay, but you cannot move your, okay. So patient is unable to move the right knee due to fracture, but for the other parts of the joints, it's normal and it's unaffected. And the vertebral column, we cannot inspect due to the position of the patient. And so the patient's head is in normal size and form, and by palpation, there are no deformities. And can you open your eyes? Okay, so the eyes is in normal size and form and also normal color. The nose is in normal size and form, but the nasal wing participate in respiration. The lips is also in normal size and form and also normal color, and there's no fissure around the lips. And for the neck and thyroid gland, in inspection, it looks like it's in a normal physiological shape. And the thyroid gland, okay, it's not palpable. And now for the body temperature. Okay, so the body temperature is 36.2. in conclusion, the general condition of the patient is middle grade. The patient's Glasgow Coma Scale is 15, where the patient is having alert consciousness, and patient is having a false posture where he's lying on his supine position with his right leg fixed by a splint, so his right leg is immobilized. And on the right calf, it is said from the paramedics that the patient have a open fracture, so it will be further investigated in the local status. So the patient's nasal wing participates in respiration, and other sites and systems besides the local status, like the muscular system, bone, it's not affected for other systems. And by comparison of the finding of the paramedics and through the conclusion of the general inspection, so patient skin color have been recovered from pale color to normal skin color, and also the skin moist has also been recovered, and the turgor is also returned to normal. So this indicates that patient's condition is improving through the reperfusion by the infusion therapy given by the paramedics, and the patient pain phase has been reduced to normal phase without pain, so it indicates that the morphine given is properly working. Yeah, it's functioning. And for recommendation, I would prefer further investigation to put emphasis on cardiovascular system and musculoskeletal system, and fluid and electrolyte test is recommended to monitor the state of perfusion.